Dr. Devipriya Soman currently serves as Associate Professor in the Department of Kaya Chikitsa, Amrita School of Ayurveda. She has presented papers in various national and international seminars and received Best Paper Awards. She has received the Ashtavaidyan Sri E.T. Neelakantan Moose Memorial Award for thesis in the year 2014. She has also completed an online certificate course in statistics and medicine conducted by Stanford University. With great respect, I welcome Dr. Devipriya Soman to please take over the session.
Thank you, Doctor. Om Amriteshwari Namaha. My humble pranams at the lotus feet of my Guru, Amma. So, directly coming to the topic, pharmacovigilance in clinical practice. A new drug gets introduced into the market after going through various phases of clinical trials. The data on the safety and efficacy of the drug largely depends on the thousands of samples which were involved in the previous studies. But even then, the risks and benefits involved in the usage of that drug's safety profile comes with the wider use of that drug in wider population, and that too looking into a longer phase. That is, when the drug is tried for a longer period, then only we'll be able to know what are the risks and benefits involved in using that particular drug. Sometimes in clinical trials, the rare adverse events may not be observed. That too is because of the lack of long duration of the clinical trials. Moreover, unforeseen interactions, that too with the existing comorbidities as well as the drug therapies, that may not also be available during the clinical trials. So, it is the duty of, or it is the observation of a clinician to look into the safety of the drug profile. And this is what happens in the real world practice. Now, why pharmacovigilance in Ayurveda? So, as the previous speakers were telling, there is a global market escalation of Ayurveda drugs, that is traditional drugs, is prevailing currently. And the concept of drug safety has now become a universal concept regardless of the medical stream. Moreover, there are reporting of adverse events which is raising a public concern. And misleading advertisements are still pertinent, which offers false claims and promises. Moreover, a central regulatory authority available will be helpful to minimize the scrutiny of the concepts and rationale of Ayurveda. There comes the relevance of pharmacovigilance, which helps to identify the safety concerns associated with medications and drugs. Then, the concept of Shuddha Chikitsa is highlighted in our science. So, right from the drug identification and properties, etc., are mentioned in our drugs, in our samhitas, which may be pointing to minimize the ADR. So, as you all know, there is a mentioning of a synonym of Vyakri for Chitraka, which means that there can be symptoms related to skin, or skin rashes can appear if improperly Shodhita Chitraka is used. And the yogas are specific of Dosha Haratva and Vyadhi Haratva. That is, it means if those yogas are not specifically used in that particular dosha, avastha or vyadhi, it can result in certain unintended actions. Then coming to the dosage. It is very evident that while mentioning in the context of rasayanas, it is evidently mentioned that there is pravara, avara, madhyama matra for rasayanas. And that too for children and for old age people, different dosage measures are mentioned. Then ultimately comes the yukti of the physician, where he can decide as to which chikitsa, where and when to use. These all are intended for a safety measure to minimize the ADRs, pointing to patient sensitivity to drug or therapy. Even then, we notice that some unexpected events happen in our clinical practice. And this can be attributed to the improper use of the medications, poor quality of medications, and deviation from the Roga-Rogi Pariksha. Now, how can a physician benefit from pharmacovigilance initiative? The instant benefit is that the physician is able to know what is the cause for this event. He'll be able to analyze what has caused it. And from the dosages and from the suspected drug and from the de-challenge and re-challenge which he has initiated, he'll be able to gather information. And thus he is able to take self-experience from that particular event. Moreover, when every physician tries to report it, it becomes a collective effort. And later on, these knowledges can be kept as a dependable repository for the future clinicians to refer, as well as the contemporary physician to work on it. Following the repository, it may lead to production of protocols to manage the adverse events in clinical practice. Even then, we see that there is underreporting of ADRs among clinicians. In a paper which was published in a reputed journal, it showed that a survey was conducted among educational institutions across the country, where it is reported that the ADRs are underreported majorly because of difficulty in deciding the ADR, difficulty in identifying the ADR, and it is because of lack of time to report. So when to suspect ADR? There are certain contemporary causes for ADRs with Ayurvedic medications, like the heavy metal poisoning. We had an incident in our department. For a thesis study, we were trying to prepare a yoga. So as part of the thesis study, we had to go for a physicochemical analysis of that particular combination. So when we were much surprised when the report came, because it had contents of mercury, lead, and other heavy metals which was above the permissible limits. So we actually completely avoided using that particular yoga, and we had to remake it again for the use of the study. And that could be attributed to either the heavy metal contamination of the drugs, or it can be because of the contamination from the machines or where it was prepared. And new proprietary medicines in the market about which safety data are not available. Then new drugs which are not reported in Ayurvedic classics, and adding of these new reported drugs along with the traditional medicines are also seen to practice widely now. There is a new drug combination for dry cough which is available in the market, which contains a fruit extract which is being mixed with the traditional drug. So actually we don't know what is that fruit extract actually, and it does not have any reference in the it is not available in the Samhitas too. So these are all places where we can suspect ADRs. And moreover, extracts of herbs that are also being marketed without much profile of safety profile. Also, deterioration can happen upon storage. The drugs the combination or yogas which contains sugars and salts, it can undergo impairment, or it can undergo deterioration in its quality, which can lead to contamination of fungus, microbes, etc., which can reduce the potency of the drugs. Drug dispensing. In our Samhitas, the drug dispensing is mentioned in the terms of grams, milligrams, etc. But now as clinicians, we practice in the terms of spoons, 1 teaspoon, 2 teaspoon, etc. That can also initiate a suspected ADR because of the difference in the quantity which is actually prescribed for that particular drug. Also, there is a practice of giving lump sum amount of drugs and ask the patient to divide himself and take. That also can initiate a change in the dose of the patient which need to take at a particular time. Then long-term use of drugs. In our Samhita, it is specifically mentioned certain drugs should not be used for long, like Pippali, Kshara, etc., Levana, etc., should not be used. But we are not very cautious to make the patients aware that such drugs should not be used. So taking long-term drugs also can induce ADRs. So now, ADRs which are reported in Ayurveda, we could analyze them in two ways. That is, certain symptoms pop up which we can analyze based on Ayurveda Siddhantas. Like when we take Balladaga, we can suspect if it is not properly done Shodhana for that, we can suspect that certain skin reactions or certain Pittavriddhi Lakshanas can happen. So that could be grouped under Prakriti Samaveta Lakshanas. But there are some other clinical symptoms which can manifest, which we cannot explain on the basis of Ayurveda Siddhantas. So I had an experience in my clinical practice where I had prescribed Maharasnadi Kashaya for a neurological condition. And just after 3 days, a WhatsApp message came from the patient telling that I have developed blisters in my oral mucosa and I have stopped the medicine. And using, after 3 days, the symptoms got relieved. So it was totally unexpected. Maharasnadi Kashaya, which is almost a Tridosha Shamana drug, would never induce a Pitta Vriddhi Lakshana. So it couldn't be substantiated on what basis the patient developed this oral mucositis. So such things should be surely reported to the peripheral pharmacovigilance centers. All these things have been previously discussed. ADR reporting form also have been discussed. Online reporting system also have been discussed. So what to be done to minimize ADRs? So we have to shift from OTC to only prescription medications, from renewable prescription to non-renewable prescription. We have a practice of using the same prescription and we go to Ayurveda shop and we take the medicines. So that has to be stopped. Special prescriptions should be encouraged. That is, the drugs with narcotics should be specifically mentioned and it should be only given from the pharmacy with a prescription only. And now certain combinations of drugs are available in the market which contains cannabis, etc., which are widely used over the counter. That should be restricted. Then another is restricted prescription. Then there should be proper surveillance and reporting to minimize ADR. Now coming to conclusion, as a physician, we should be very cautious to always report the ADRs to facilitate the documentation of ADRs. Thereby, a database will be developed with adverse drug reactions, and with such database only we'll be later on able to formulate protocols as to how to manage it and thereby prevent further occurrence of ADR and improve the reporting system related with pharmacovigilance. With this, I conclude my presentation. Thank you.
Thank you, ma'am. Any queries?
Namaste, doctor. We have found that in certain websites of hospital pages, for example, I would like to say in AVP web page, I found that patients are reporting what they have faced because of, so they say I applied this oil and then I developed heat rashes. Do you think that because you are in a clinical practice, do you feel that the physician should actually respond? So we find patients writing like this, but there is no response given to them. Now we do not know whether the physician is sending a private message, but then the person reading this, if it is an outsider, they get the idea that, okay, if I apply Balashwagandhadi Thailam, I may get heat rashes. So does it become the need of the hour that a clinician should actually address such reports that is mentioned in the web page of the hospital or the college?
Actually, the authorities who are responsible for making them visible, they should be much cautious before the physician should react. Actually, some authorities will be giving permission them to write it. It may be so like. So, actually, the authorities should take enough concerns before they make it visible to the public. Thank you very much.
We extend our sincere gratitude to Dr. Devipriya Soman for her contribution to today's session. Thank you, ma'am. I welcome Dr. Priya ma'am to felicitate Dr. Devipriya ma'am.